Here is your question. Right. So if you have read and understood, considering its surgical anatomy station, kindly please tell me if you can identify the structure which has been described in the stem.
Ma'am, as per the description, as the swelling is in front of the ear, I
Yes.
think it be parotid swelling.
Parotid swelling. Okay. How would you confirm it? Can you tell me precise surface anatomy of the parotid swelling, please?
Yes, ma'am. It has an upper border which extends from the tragus of the ear to
Yes.
the center of the mastoid, and
Okay.
anterior border which extends from anterior side of the tragus of the ear to the posterior border of the buccinator.
Yes.
Sorry, masseter, and then from the masseter to the 2 centimeter below and behind the angle of the mandible.
Okay.
And a posterior border which extends from the center of the mastoid to the point 2 centimeter below and behind the angle of the mandible.
How would you divide this organ or the structure parotid?
It is divided into a superficial lobe and a deep lobe, ma'am.
Okay. And how many borders and how many
It has
surfaces that you can see? Or
yes, ma'am. It has a lateral surface, an anteromedial surface, a posteromedial surface,
yes.
and a medial border, anterior border, posterior border, and then upper border.
Can you name the structures which pass through it?
Yes, ma'am. The facial nerve, the external carotid artery and its branches, superficial, temporal, and maxillary,
Yes.
and auriculotemporal nerve and deep parotid lymph nodes.
Okay. Can you please tell me? There is also one duct associated with it. Can you tell me the opening of that duct?
Yes, ma'am. The Stenson's duct,
Yes.
it opens opposite the second upper molar tooth, ma'am.
All right. Can you also tell me what are the normal or the common conditions with which parotid gland presents?
It can be infective conditions such as parotitis or mumps, and inflammatory conditions causing swelling of parotid glands such as Sjogren's syndrome. It can be tumors of the parotid such as pleomorphic adenoma or Watson's tumor or malignant tumors of the parotid, or it can be parotid swellings due to obstruction of the parotid duct due to calculus or external compression of the duct.
Okay. If you suspect obstruction of the duct, how would you or what would you ask for the imaging to confirm your diagnosis?
We can investigate the patient by a xylogram.
Okay, can you please tell me what kind of image are you looking at, please? And if you can describe it for me, please.
This is a xylogram, ma'am.
Yes.
Probably showing
which side,
the
maybe?
this is,
Left?
right,
maybe.
left side.
Yes. If you can explain or describe what exactly do you see?
Here we can see continuity of the dye from the upper second molar region,
Yes.
going all the way till the gland, ma'am. So
Do you
there
see
doesn't
any obstruction anywhere? Or what do you see? Is there continuous flow?
there is a
There's no
continuous
obstruction?
flow, ma'am.
Yes. Okay.
There is continuous, ma'am.
Right. Can you please tell me what is the blood supply of the parotid gland?
The blood supply is from the branches of the external carotid artery. Yeah, ma'am.
Yes, and the venous drainage, because
Uh,
yes. it comes
Yeah,
together?
by the retromandibular vein,
Yes.
which is formed by the union of superficial temporal and maxillary veins in the gland.
And the lymphatic drainage goes where?
The lymphatic drainage is via the superficial and deep parotid lymph nodes, and ultimately to the deep cervical lymph nodes.
Okay,
Upper
good.
cervical.
Yes. Yes, if we can talk about the parotid gland as a whole, what type of gland is it?
It is a serous type of gland,
Yes, very good. Can
where
you tell? Yes, continue, please.
the parasympathetic stimulation produces serous fluid, and the
Very good.
uh, sympathetic stimulation produces enzyme-rich fluid.
Right. Okay, good. Can you please tell me if a patient presents with the swelling in the parotid region, what are the differential diagnoses that you'll consider other than parotid gland? What else could it be?
It could be submandibular gland swelling.
Okay.
It could be skin or subcutaneous tissue tumors such as lipomas or dermoid cyst.
Yes. It could even be parotid lymph nodes.
Lymph nodes
Lymph
as
nodes
well.
of the parotid region. Okay. Right. Can you please tell me what are the things that you, or what is one thing that you have to keep in your mind as a surgeon while operating in the parotid region?
The facial nerve.
Anything else? Damage to one small nerves fibers which
or
continues, yes, or carries the parasympathetic.
auriculotemporal nerve.
Yes, very good. Which can result into what condition? Injury, yes.
Fraze syndrome.
Fraze syndrome. Okay, can you describe what is Fraze syndrome?
Uh, Phase syndrome occurs following parotid surgery, where there is damage to the parasympathetic fibers from auriculotemporal nerve, and following which there is a aberrant reinnervation, where the parasympathetic fibers grow back into the sympathetic fibers supplying the sweat glands of the skin, which
Good.
leads to sweating during
What is another name given to this condition?
gustatory
Sweating.
sweating.
Yes, very good. Okay, if we talk about little bit about the tumors of the parotid gland or the parotid region, can you name the ones which are the most common?
Benign tumors such as pleomorphic adenoma is the most common one, ma'am. And then
Yes.
Warthin's tumor. And then in malignant tumors, mucoepidermoid carcinoma is the most
Yes.
common, ma'am. Acinic cell carcinoma.
Which tumor is associated with the lifestyle, smoking and habits?
Malignant tumors, ma'am.
Okay, are you sure?
I'm not sure of it.
Any benign tumor which is common and it's also associated with smoking, etc. Okay,
Tumor
right.
Warthin's tumor.
Yeah, most likely. Okay, if yeah, you've already told me the structures which pass through it, but can you tell me, if you have to tell me in relation the structures which pass through the parotid gland, if you can tell me from superficial to deep, how do they pass?
The facial nerve is the most superficial, ma'am. Then we have the carotid artery, then the auriculotemporal nerve, then retromandibular vein. Then we have the deep parotid lymph nodes.
Okay, what about the auriculotemporal nerve?
Auriculotemporal nerve, I've told, ma'am. Before
It
the
passes deep to, yes, it passes quite deep. All right, good. Okay, thank you so much.
Thank you.
This we have discussed. Very good, excellent.